Hi everyone, I'm Dr. Z. I'm a clinical psychologist. Forgot who I am for a moment there. Specializing exclusively in adult transgender care. Welcome to my channel. If you're new here, please make sure you do subscribe. If you're regular subscribers, thank you so much for being a subscriber. And welcome to coming back of now is going to be Fridays Q&A sessions. What are Q&A sessions? This is where I answer your direct and specific questions. So if you do have a question for me or questions, link to my email is below. It's very simple, info@drzphd. Go ahead and email me your question. Just make sure you keep it concise and brief, and if not, I'll always email you back and let you know that your question is too long, it needs to be shortened. But this is a place where pretty much you can ask me anything, and you get to ask me anything in regards to what's nagging at you, what's keeping you up at night, what are you feeling stuck with, what is problematic to you, and then I do my best to give you some guidance and some tips. It's a great segment for everybody to tune in, because also you have your fellow individuals commenting below and sharing additional tips. So this is really a great Q&A segment for all of us. Without further ado, for today I have chosen 5 recent questions. As always, I put all of the questions in a folder, and then I randomly select 5 and I go through the folder until every question gets answered. So I guarantee you your question will get answered as well. And as always, I black out everybody's name for privacy reasons. So without further ado, let's get started. I'm really excited to see what we have today for our Q&A. Question number 1. I'm 19, assigned male at birth, and I've been questioning my gender for years. I'm unsure if I'm trans woman, a feminine gay man, or just confused. I often imagine myself as a girl and feel discomfort with being perceived as masculine. But I also have some comfort in being a boy. How do I figure out which gender I actually am when anxiety, overthinking, and a need for clarity make it hard to trust what I feel? This is a great question, and this is a question that is going to resonate with so many of you out there who are not only in this younger age group, young adults, 19, but who are also prone to anxiety, overthinking. Anxiety and overthinking a lot of times will go hand in hand, because anxiety is going to make one start ruminating about things and start thinking about things and creating a kind of a circular loop inside of your headspace. If you're also prone to overthinking things to the point of getting into this position where you just feel paralyzed and not able to make a move, because now you just have kind of exploded the situation out of its proportion, this is also going to be helpful to a lot of you. And a lot of you are also prone to catastrophizing, which is a common part of anxiety, to be able to catastrophize and to overthink things. So what do? You're 19 years old. For those of you who are young adults, you've been questioning for years, but you're still unsure. And you're unsure primarily because as these individuals, they're wondering, could they be trans women, feminine gay men, or just confused? If you find yourself in a category where you are wondering if you are certain elements of different gender identities, right? So in this case, we have trans woman, then we have a feminine gay guy. Then my suggestion to you, if it's not clear cut in your headspace yet, my first suggestion for you is, first and foremost, to dial back from social media, dial back from content, especially if you engaged on social media where you're asking strangers for advice. Reddit can be a great place for a lot of information gathering, but Reddit and any part of internet, in my opinion, is not the best place for very personalized advice, because people are always going to project into the advice their own experiences, and it's not going to be fully applicable to you. So my first is to dial back if you're feeling overwhelmed and confused. Now, because you're trying to figure out if you're maybe trans woman or an effeminate gay man, what are the small steps you can start taking? Exploring between those two, where do you land? without going extremely into one or the other. Oftentimes, I recommend for people to start taking small steps toward the one that is closer towards their self proximity. In your case, what's going to be closer to self proximity right now is it possible that you are a feminine gay man because you are assigned male at birth, right? And you're wondering, is it possible that you're just a feminine? Your sexual orientation is also gay. So you kind of wondering how much of that goes hand in hand. My suggestion for you is, can you lean into that femininity, into that maybe even internal need for femininity with your current assigned gender, in a sense of starting to present more a feminine. So lean into that identity of a feminine gay man as much as you can, and try to experience it for a duration of time. Try to experience it for not just a week or 2 weeks, but for a duration of 6 months in different social contexts, in relationship, in friendships, in intimate encounters. And what does it tell you? How does it sit with you? Does it resonate? What is it about a feminine gay? What is it about living your life as a feminine gay man that doesn't align, doesn't feel good? And if you have moments where you are, like you said, you imagine yourself as a girl, when you imagining yourself as a girl, what is it about identifying or being a girl that resonates with you? Everything has an underlying stems of roots, as I always say. For some people, the reason why they want to identify towards feminine energies is because this is part of who they are. It's part of their expression, maybe it's part of their role, but it's not part of their gender. For other people, they want to identify because that's exactly what their gender is. Their gender is that of a very feminine identity. So you need to be asking yourself, what is it telling you? Now, if you gave yourself a shot to lean into feminine gay man presentation or gay man embodiment experience for a good substantial time, and things still don't feel like you, then how can you start then trying and pushing the envelope through exploration without getting into medical or surgical aspects of transition? So just exploration towards a more feminine, trans woman, more like a binary end of spectrum, and again, see what it tells you. That is the only way to find out. The only way to find out when you're feeling this confused is to start exploring. Now, here's my tip for you with anxiety and overthinking tendency. As you explore, start journaling. Start writing down what you experience. What about particular experience? Concretely write down what about it feels good. What about it and why it feels good? What is it telling you about yourself? When you write things down, you are more likely to be focused and to stay on a subject matter. When you're just analyzing it in your headspace, lots of your fears, resistances, a lot of other things tend to pop in, and as a result, it makes things that much more difficult. So if you tend to anxiety and overthinking, try to actually write it down. And finally, least but not last, can you find a gender therapist in your area to help you dive deep into facets of yourself to figure out what's what? This would be my advice. Great question. I wish you all of the best in exploring. Anybody listening to this can attest to probably feeling something similar of the sorts. Gender is overwhelmingly confusing, and you're definitely not alone. Question number 2. One of my coworkers suspected that I was trans, so she went on Google and found a bunch of pictures of me from playing basketball. Then went around showing them to other coworkers at work. I've heard them whispering about me, and one coworker has randomly asking me questions and making statements indirectly in attempts to confirm what the ladies that started it all is true. So your coworkers are wondering if this rumor is true, right? They do not directly work for the same people that I do, but we all sit in the same small area together, and they're a part of my team. Any suggestions on how I should handle this situation? I think there's common situations that comes up a lot of people in the workspaces, especially if you are navigating workspace as a stealth in your gender. People don't know. Again, coming out of work is a personal decision. And what do you do if somebody, for example, outs you in this way, right? So this is pretty much an experience of, to some extent, being outed, right? My suggestion, this is just my suggestion, again, all of my advice and tips and guidance is just my suggestion, so see if it resonates with you. But my suggestion is, could this be an opportunity for you to just own up who you are? And if somebody is inquiring, to own that you have a transgender history and transgender experience. This will not only ease up anxiety for you, it will also make you step further into a sense of self-acceptance that will also further make you feel more confident and more solid in your sense of who you are. Because at this point, you know, when at work things of this nature happens and somebody outs a person or somebody starts questioning whether somebody has transgender history, and if in fact they do, I do think that it's actually an opportunity to just, you know, open up to it and just say, yeah, I do. Now, if you are at work where for you affirming your identity and asserting it and coming out is going to lead to drastic consequences such as being fired, which is happens, you know, does happen, that is something to consider and to think through, because we all need work, we all need money to create, you know, not only to pay for rent and have a space for safety, but also to be able to provide for ourselves. So it's a very essential need. So that's something to consider. But if that's not something that is going to happen and not a concern, I see this as an opportunity, because otherwise it sounds like this is just going to be, you know, ongoing talk. I feel like it might make you feel uncomfortable. I feel like it might increase your imposter feelings, make you feel like now everybody's looking at you and wondering about you. Alternatively, what you can also do, if my suggestion does not sit well with you and you really do not want to come out at work, alternatively, don't come out. Every rumor has a shelf life, in my experience. Every rumor eventually dies. People speculate, they assume, they talk amongst themselves, they gossip, you know, because people who gossip don't really have much going on in their life, in my opinion, to be honest. You know, this is why people gossip and make assumptions about other people. So you can just do that. You can just not come out, and you realize everything has a shelf life, and eventually this rumor is just going to be history, parts of the past. So that's going to be my advice. If anybody else has some other kind of suggestion or tips, comment below. Great question. I'm sorry this has happened to you. It's a shitty thing happens when people go out of the way to share something about you that is none of their business. I can never fathom nor understand why people do that. Even as a psychologist, I understand it has to do with their need for feeling powerful and in control and maybe even popular. I mean, this sounds like a high school scenario where they want to be cool. Look, I have this rumor. And it's a shitty and a very small thing to do. So yeah, best of luck to you. Sorry that this has happened. Question number 3. Hello, I have borderline personality disorder and struggle with my sense of my own value. Through my 20s, I found a source of value from cross-dressing and sex, but now I am 30. I fear femboy death and have been struggling to decide if my urge for hormones is that or if it is legitimate. Do you think it is reasonable to want to transition if I have accepted myself as a sexual being and believe I would be happier as a girl in that sense? So this is, you know, it's not a very easy question. It's a great question, by the way. It's not an easy question because when individuals struggle with any kind of gender identity issues, whether gender dysphoria present or not, and there's also borderline personality disorder, a lot of times it can be quite overwhelmingly confusing. And I can understand why you're struggling with sense of your own value. And I have worked with people who also have had borderline personality disorder, and it's been really challenging because one of the biggest components of living with borderline personality disorder is lack of solidified and unified core self. As a result, there is individual struggles throughout their lifetime to develop a barrier. I had a great instructor in graduate school who taught a class on personality disorders. And when he talked about borderline personality disorders, the example he gave is, and this might align very much with you who asked this question, and anybody else who is struggling with borderline personality disorder, is that individuals, because there's no sense of strong self-developed, it's almost as if for the rest of the people who have a core self, we have a barrier, we have a skin that serves as a barrier between ourselves and the external world. And so when things come into contact with us, it doesn't hurt as much because there's the barrier. For borderline personality disorders, there is no barrier. This solid skin that is protecting is not fully formed. So everything that comes in a proximity or in a contact can be experienced tremendously painful and tremendously wounding to any perception of the self because it's not fully developed. For that reason, when individuals additionally, in my experience, struggle with gender identity issues of any kind, it is very challenging because there's no core sense of self, and then if there's any kind of gender identity issues which always tie to identity too, it creates so much confusion, and people can be very vulnerable to external lack of being seen in the world as one or the other. So it's a really important question. You said that you are in your 20s. You found it was very valuable for you to cross-dress and sex. I'm assuming what you mean is cross-dress and sexually enjoy yourself. You're now in your 30s, and you're afraid that this, femboy identity that you had in your 20s is going to die, and you struggle to decide if your hormones is legitimate. Do I think it's reasonable to transition if you accept it yourself? I think it's reasonable to transition for a number of reasons, including this one. I think that instead of asking whether it's reasonable for you to transition, I wonder if you can sit a little bit and ask yourself what is behind your urge for hormones? You say that it seems like here's the urge for hormones is that you feel and you believe that you might be happier living a life as a girl instead of as a femboy. But what lends you to believe you will be happier? How much of you desire to live a life as a woman? How much of that desire is coming from feeling a strong sense of incongruity or feeling a sense of disalignment with a femboy identity? Or is it just that because you struggle with a core self, there's the perception that a woman's identity, the feminine identity, is going to help you be happier and navigate life easier than femboy? These are important questions to ask yourself. There's no one clear-cut advice I can give you because this is not a very clear-cut. It's quite a complex situation, but I would wonder on those things. What is driving the need? But really important question, because for individuals who do have also just other things parallel to struggling with gender identity, things can get quite muddled and confusing. So it's not always black and white. So I wish you all of the best, and hopefully that helps you in some sort of way, and I apologize that I can't be any more clearer than that. Question number 4. I'm a trans feminine who discovered that I fit under this umbrella as an adult. The connection I feel to being male, which felt strong enough to take on label of a cis guy growing up and partly into my adulthood. Now that I know about this, I'm currently living with unacceptable family members can't at the moment afford to move out, and can't at the moment afford to move out. How to deal with all of this until I can move out? Okay, so a little bit confusing. So you discovered you're trans feminine, but I'm confused about your connection. It feels like you had very strong also connection to being male, and the connection was strong enough that you took on a label of a cis guy all the way growing into your adulthood. So I'm trying to wonder now with your question, are you feeling strongly connected to your male identity and now discovering you're equally strongly connected to your female identity, or are you realizing that that connection was false? I'm assuming what you're saying is that was a false, almost like overcompensatory function for you, where you overcompensated by being a man to an extreme, but now realizing in your later adult years that you're trans feminine, but you're living with very unacceptable family members. You can't move out at the moment. How do you deal with all of this until you can come out? So it can be very, 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 very challenging when you realize things about yourself related to gender, and at the same time you're living with family members that are just not supportive. Without a doubt, it's going to be very difficult. Now, the first question for you I would have is, to what extent do you feel solid in your trans feminine identity? To what extent do you, what I mean by that is that to what extent you're still actually questioning whether it's does stem from the root issue of gender identity, whether it is genuinely tied to your identity. If you're still questioning, without even coming out to your family members who are unsupportive, how can you take this opportunity and just explore a little bit more with a therapist? Are you able to see therapists, which you can see without you maybe family members knowing, or just see a therapist without sharing with your family why you're seeing a therapist, and explore that on a deeper level. If you, on the other hand, sure that you're trans feminine, you act cracked, so to speak, right? And you're realizing to what extent you put on this male facade, and I wonder what do you do because you're surrounded on top of that with family members who are unsupportive. Well, in that case, it's really depends on what your family dynamics are like. You can't afford to move out, but you are also an adult living with your family members. So unsupportive how, right? Some family members will say, if you were to share that you identify as trans femme, some family members might kick you out. In that case, perhaps being that transparent with them right now, if you don't have anywhere else to go, might not be the best idea. Some family members are maybe unsupportive in a sense where they say that they don't emotionally support you, they don't understand it, but you can still stay and live with them. That's a different matter. So first, pay attention to what is being unacceptable about your family. Unacceptable how and to what extent. What is going to happen if you're going to start to explore yourself. If you're in a situation where you absolutely cannot share anything with your family right now, then before you step into any kind of gender ownership of yourself, can you put your little ducks in a row, and can you start maybe finding a way where you can be in a better position where you can afford to move out? What would that entail in your case? Are you currently looking for employment? Do you need to take some kind of education to get some kind of inter-trade certification? In other words, what do you need to do? What would you need to do to move out and to live by yourself? Because if you identify and you already know for sure you're trans femme, and on top of that, if there's gender dysphoria present that is affecting your well-being, then it lets me to believe that at some point you may be wondering if gender transition is something for you. If it is something for you, you're still going to benefit by living by yourself, because then you don't have to be in this negative environment with unsupportive family members, right? And you'll have all the privacy to explore, to feminize, to fully embody yourself. So in either case, it sounds like it's going to benefit you to be able to find a way to put yourself in a position where you can afford your own place and you can afford your own somewhere to live by yourself. That would be my recommendation. A lot of times we feel very impulsive, and a lot of times we feel that we just want it now, we want to come out, we want to start things now, we want to start hormones. But transition, anybody who is watching this who is going through transition or being through transition, know that it's a process, and also understand that there's a lot of elements that are present in it, and you do need to have access to resources. It's not just all about studying hormones. It's also, and it's not even whether you're going to want a surgery or not. It's also about being able to have access to resources to see providers that you need, to be able to have access to resources to even have something such as hair removal done or voice training done, if that's something that you're interested in. Those things become really important. So a lot of times people just want to re-band-aid and just want to come out and do it all now, but then they realize they haven't really thought about the resources they're going to need. They haven't really thought even the cost of all of it that's going to pile up. So it's really important to have a more kind of a bigger picture of your situation, and especially right now, if you are in this unsupportive environment, what can you do to get out of it so that you are supporting yourself? That would be my first guidance and advice for you. Great question. Hopefully this is helpful, and I wish you all of the best. And final question for today, question number 5. As a non-binary person in an unsafe country, recently diagnosed with recurrent depression and ADHD, I'm wondering if low-dose testosterone could improve my condition. Given that full masculization isn't my goal, and I hadn't planned on hormones in my circumstances, is exploring this option worthwhile, especially taking into account my ADHD? And this person actually wrote me, I have here a bigger email about this for the context and the background that I also had a chance to read before I asked them to shorten. And I see that in here you also share that you have no desire to have a very binary masculine appearance. And previously you were leaning towards not studying hormone at all. So to me, the way I understand your question is that you're primarily wondering whether masculinizing hormones, in this case, since you're not interested in masculinizing effects as a non-binary person, you're primarily interested whether masculinizing hormones are going to help you alleviate depression, and how will it actually work with being diagnosed with ADHD. This is what I understand the equation being. Excuse me. Recording lots of videos, and now I have this amazing whispery, smoky voice, which I adore. I know that I talk a lot in this channel, and a lot of other people talk about how studying hormones alleviates dysphoria, and if depression and anxiety also are byproduct of dysphoria, not a standalone diagnosis, studying hormones also helps alleviate it. I also want to point out that I always talk about feminizing hormones in that case as helping alleviate all of this. Yes, masculinizing hormones for individuals who are interested in those hormones, for whom depression and anxiety is also not just a standalone issue, but a byproduct of dysphoria, does help. But the reason why I don't recommend that to find out, because masculinizing hormones are a much more powerful hormone than feminizing hormones in producing physical changes. I have seen people who were on a low dose masculinizing hormones, and within a week or 2 weeks, they had physical changes. Their voice cracked within that short period of time. I equally seen people on masculinizing hormone, full dose masculinizing hormones for years without their voice cracking. It just gives you an idea how incredibly variable it is and depends on individuals. For somebody like you, who's not interested in masculinizing features as a non-binary person, but you want to see if it's going to help you alleviate other symptoms you're feeling. My feeling is that it might not be the best option to go. If I were working with you, this is not the way I would go. Because the risk of you getting masculinizing effects you do not want, one, is up. Two, the risk of you getting masculinizing effects as a non-binary person in unsafe countries that you mentioned, and then your risk of safety going up, those two enough for me as a provider working, if I were to work with you, I would have said no. I don't think I would have advised you against starting masculinizing hormones. Now, I'm just making sure I'm reading this again. So, if you were recently diagnosed with recurrent depression, is it possible the provider that you're working with, first of all, can you be open with this provider that you also have, do you actually have gender dysphoria? If you do, that you have gender dysphoria. If not, can you be open with this provider that you identify as non-binary? And to ask this provider to explore and assess further if your recurrent depression is a standalone issue. Is it also possible, this is for you to explore, that your recurring depression is coming back because you're living in a country where it is unsafe? Maybe you are living also in a country where there is no, well, it sounds like there is no room to identify and being seen as non-binary. In the very least, in a country where people will not respect your gender-neutral pronouns. If you're living in that type of a country and you're prone to depression, it could recur just because of your circumstances. In which case, again, I don't think masculinizing hormones are going to help. If anything, I feel like it's going to increase all of the distress because, again, your chance and risk for all of these unsafe things are going to go up. What I would recommend instead is find out what's really causing your recurring depression. ADHD is a separate thing right now, right? ADHD is just, and not only there's medication to help with ADHD, but there's also a lot of learning skill sets and tools that one can learn in order to better their attention. But the depression, which is a much bigger concern for me because it can really affect and stifle your everyday life and your everyday well-being. So first would be what's underlying your depression. If it is that it is so unsafe and you're not being seen and you're not being acknowledged and you're struggling with that, then I would recommend how can you connect to non-binary support group online? How can you connect to other maybe people out there in the world, just the way you're connected to me in a world, who can support you, where you can get support, where you can get a sense of visibility. So that way, while you are in your country where you don't feel seen and you don't feel fully safe to be yourself, you are getting an extension, you are getting that need nourished from a distance. That would be my number one advice. My second advice for you would be, how can you acknowledge, how can you own, how can you work on holding on to your identity from within and cultivating that from within? What would it look like for you? But studying masculinizing hormones, I honestly, for me, from my experience, I would not recommend. I understand there's providers who will disagree with this, or maybe not even disagree, I don't know, but all I can go off of my experience. I just, given everything you shared, additionally that I also read, the fact that you don't want a masculinizing effect, the fact that you are at an unsafe place, I think masculinizing hormones to help you with depression I think it's just going to do the opposite. So that would be, hopefully this is helpful to you. Just really do consider looking into what is the underlying issue of depression for you. These are fantastic questions. Thank you everybody who asked them. Thank you everybody for your personal, vulnerable, open questions, sharing also other things you're struggling in the segment, borderline personality disorder, tremendous anxiety and overthinking, ADHD and depression. These are all vulnerable issues to share. I know it is really hard out there. I know that all of you can also get through this. I know that all of you are far more resilient than you realize. Again, if you would like to participate in the segment, email me your question or questions, no matter how personal. As you can see, everything is, your names, your emails are all blacked out, so it's all completely autonomous. I look forward to all of your questions. Hopefully this was helpful, and I will see you all in the next video. Goodbye.